Good afternoon, everyone. Welcome you all on behalf of net.America. We are women-owned intermediary and U.S. federal contract, and we have been working on multiple contracts for over 20 years under the leadership of our CEO, Claire Hines. And we have both youth intermediary under the leadership of John Sharp and industry intermediary, expansion intermediary under myself. And today we are welcoming you with our fellow intermediaries, AFL-CIO training funds, Equus, HCAP, and we are very happy to have this event on the very important topic on mental health and behavioral health. After pandemic, when we were all working from home for 2 years, the anxiety was piled up and mental health issues, domestic violence, and behavioral health issues went skyrocketing during the pandemic. It impacted not just the adult but also young adults. So the question is, how do employers and sponsors address these issues, look for warning signs, not only for adults but also for our young apprentices? So we put together great panelists to discuss this very important topic today. Before we go into the discussion, I want to welcome our speakers, Cierra Mitchell from US Department of Labor. Cierra Mitchell has over 15 years of apprenticeship, workforce development, policy and program management, business engagement, and marketing experience. Cierra currently serves as the Division Director for Business Engagement, Marketing, Performance in DOL's Office of Apprenticeship. Cierra has previously worked in DOL's Employment and Training Administration Policy Office, where she has assisted with the implementation of key pieces of legislation, including the Workforce Innovation and Opportunities Act. Under the contract, Cierra managed and led the Employment Readiness Program at Fort Eustis for several years, where she helped military spouses find rewarding careers, which fueled her passion to work for DOL to improve employment and training opportunities for employers and workforce of the future. She plans to share her experience and address the key, important discussions on our very own topic. Without much delay, I want to welcome Cierra Mitchell.
Thank you, Padma, and good afternoon and good morning to some of you. On behalf of the Department of Labor's Office of Apprenticeship, I want to welcome everyone to the Wellness in the Workforce Occupations, Resources, and Strategies Accelerator. We appreciate you taking the time to join us for this important and exciting webinar today. I also want to take a moment to thank all of our sponsors, speakers, panelists, and apprentices, including our industry intermediary contractors, who've been working hand in hand to put this accelerator together. So for those of you who are wondering what an accelerator is, it's basically a convening of stakeholders to spread awareness about the value of registered apprenticeship. Although registered apprenticeship has a proven track record and is in high demand, we've realized that there are still some employers and organizations that aren't aware of it. So we've been having these accelerator convenings as a broader part of our Office of Apprenticeship industry engagement strategy to help bring awareness to registered apprenticeship and make sure that everyone knows the value that it brings. As you may know, registered apprenticeship has grown significantly over the past 10 years, over 70% to be exact. But we've seen a significant increase in demand during and following the pandemic. So, registered apprenticeship has not only become a Department of Labor priority, but an administration wide priority, as it's seen as a key workforce strategy and a solution to meeting high demand industry and workforce needs. For example, in December of last year, during all the critical supply chain needs, we launched a 90-day trucking apprenticeship challenge in coordination with the White House and Department of Transportation to bring awareness to industry. And we did that through accelerators just like the one that we have today. Because of those accelerators, within 90 days, we were able to help over 100 employers and industry associations to create over 100 apprenticeship programs and hire approximately 600 apprentices. Similarly, to meet critical cybersecurity needs, we recently ended a 120-day cybersecurity apprenticeship sprint where we held multiple accelerator events, bringing together industry, education, equity partners, and employer partners. And in less than 120 days, we were able to help approximately 200 employers and labor unions create cybersecurity programs in hard to fill occupations and hire approximately 8,000 apprentices. At the same time, we've been laser focused on the healthcare sector and how we can meet those critical needs as well, especially in regards to mental and behavioral health. In fact, thousands of healthcare employers across the US are currently using registered apprenticeship training to recruit, train, and retain workers with the right skills and qualifications. And according to those employers, registered apprenticeship has been the most effective training model for enhancing the industry's performance and results. Healthcare is an emerging sector for apprenticeship, but has seen increased demand, especially during and following the pandemic, as Padma mentioned earlier. A few of the key mental and behavioral health related occupations that we're starting to see an increased need for is around behavioral health technicians, peer counselors, and substance use disorder professionals. But we're not only trying to strengthen the mental and behavioral health workforce through registered apprenticeship, studies have shown that apprenticeships themselves are good for the mental health of apprentices as they gain a supportive network of mentors and peers. By promoting the physical, economic, social, and mental well being of workers, we are creating a mentally healthy workspace and further benefiting apprentices and trainees. As we all know, apprentices who are healthy and happy in the workplace are primed to learn and will retain more information. Studies also show that mental health conditions have a considerable impact on worker performance, creating issues such as absenteeism, tardiness, and presenteeism, as well as affecting morale and physical health. Apprenticeship training programs are utilizing a number of strategies to combat these conditions and reduce their impact, including treatment programs, education and awareness programs, return to work programs, peer support programs, and preventative programs. With that, I'll turn it over to Padma so you can hear about some of the exciting work that our partners are doing to meet mental health and behavioral health needs through registered apprenticeship. Thank you again for joining us today. Padma, over to you.
Thanks, Sierra. That's very interesting. As we discuss, mental health and behavioral health issues are really very important, and the BLS statistics show that there is a great demand for this profession, and we are not yet much discovered a lot in apprenticeship world. And not just in apprenticeship world, even in mental health professions at entry level, we haven't started discovering a lot, and there is a huge demand. Let me welcome our next speaker, Dr. Valerie Maholmes. She is the chief of the Pediatric Trauma and Critical Illness Branch at NICHD. In this capacity, she supports research and training in trauma, injury, and critical illness across the continuum of care. My son, who is going to be a resident soon, did a 3 months rotation as well as subai in mental health in pediatric ward, and he had shared a lot of information with me about children's mental health, and that was really mind boggling to me about young adults and what are the different stress that they go through and the pressure and the competition of the standard test and the education as well as the society that they put them through these pressures. And I'm sure Dr. Valerie Maholmes is going to share a lot of those experiences with us. She serves on numerous NIH and federal interagency working groups to further the mission and goals of the branch. Prior to joining NICHD, she was a faculty member at the Yale School of Medicine in the Child Study Care Center, where she served in numerous capacities, including Director of Research and Policy for the School Development Program. In this role, she provided an array of educational, clinical, and technical support services to schools in low income neighborhoods and communities around the country to promote child health and well being. In 1999, she was named the Irving B. Harris Assistant Professor of Child Psychiatry. In 2003, Dr. Maholmes received the Executive Branch Science Policy Fellowship sponsored by the Society for Research in Child Development and American Association for the Advancement of Science. That's a great honor. Without much delay, I would welcome Valerie to share some of her knowledge how we can identify the warning signs from our young adults who are apprentices and young workers, and how do we prevent before something bad happens, and how do we train them to withstand the stress from today's world. Dr. Valerie Maholmes.
Good afternoon, and thank you all for having me to participate in this very important program. I am going to start out, of course, repeating a bit of what was already said, but start out by saying that healthy and resilience of health and resilience of the individual is associated with a healthy and productive workforce. So whatever we do at early stages of development, I think pays it forward to well-being in the future. So because the youth is a population I focus on, I'm going to start with the big picture of health and well-being, of the global impact of youth mental health, and kind of bring it down to the day-to-day, and if there's time, certainly to discuss some of the strategies. But I also want to really emphasize who's at risk and why, and a little bit I'll intersperse with what we can do to help. So I want to start by saying that youth mental health has become such an important public health priority that the U.S. Surgeon General released an advisory in 2021, around this time last year, focused on protecting youth mental health. And he said that mental health challenges in children, adolescents, and young adults are real, and they are widespread, and most importantly, they're treatable and often preventable. And that's what I want to underscore to those of you who are listening and thinking about engaging youth in your various programs. And this is a global concern. It's estimated that 1 in 7 10 to 19-year-olds experience mental health conditions, accounting for 13% of the global burden of disease in this age group. And these conditions remain largely unrecognized and untreated. And that's what's important for us to keep in mind as well. Adolescents with mental health conditions are particularly vulnerable to social exclusion, discrimination, stigma, and that stigma affects their readiness to seek help. We call it help-seeking behaviors. It leads to educational difficulties, and then going forward to workforce difficulties, risk-taking behaviors, and often leads to physical health problems. Depression, anxiety, and behavioral disorders are among the leading causes of illness and disability among adolescents. And sadly, suicide is the fourth leading cause of death among 15 to 19-year-olds. And that's the world stage. But in the United States, mental health problems impact up to 50% of adolescents in their lifetime. And even before COVID-19, mental health challenges were the leading cause of disability and poor life outcomes in young people, with up to 1 in 5 children ages 3 to 17 reporting some type of mental, emotional, developmental, or behavioral disorder. So let's say a few words about who's at risk for mental health issues and why. Looking at the various populations and disparities in terms of mental health outcomes, we know that sexual minority youth are at risk for mental health problems. And reportedly, they experience higher levels of violence in school, in the various workplaces. There's bullying and sexual violence. They're at risk, significantly higher risk levels for suicide, depression, and substance use. And they have high rates of physical and emotional bias and the violence and rejection by their families and peers. And this leads to further stigmatization. Youth from low-income households are also at increased risk for mental health disorders. One thing that I want to underscore, we talk a lot about the social determinants of health related to housing stability, insurance status, and proximity to services. But for many youth, the poor mental health of their parents may adversely affect their mental health. And so this is important for organizations and schools and youth-serving organizations to consider in your strategic priorities for addressing mental health, not only addressing the needs of the young people that are apprenticing with you or that you may employ, but also taking a broader, more comprehensive and family-centered approach. Many youth that are involved in child welfare and juvenile justice are at high risk for having a mental disorder. 50% of children and youth in the child welfare system have problems. 60 to 70% of youth in the juvenile justice system may have a diagnosable mental health disorder. And the risk for mental health, especially traumatic stress, is greatly increased for kids who are living in foster care as a result of abuse and neglect. And even if they've aged out of foster care, they still have the experiences and feelings of abuse and trauma that occurred in their early childhood. And children who suffer from traumatic stress after experiencing or witnessing the injury or death of someone else, or otherwise feeling seriously threatened, continue to experience that stress for a long term. And there might be things in the work environment, in the school environment, in the apprenticeship environment that may trigger that trauma and traumatic stress. So we need to be aware of that. Other considerations are that many racial and ethnic minority children and adolescents experience what we call compounded community trauma, which has been defined as the experience of children when they witness violence in their homes and in their neighborhoods. And this trauma has been linked to high rates of mental illness, including post-traumatic stress disorder, depression, and what we call externalizing behaviors. Youth of color experience disparities in prevalence and in treatment for mental health issues. One thing that I want to leave you with as I kind of wind down this introduction is what we call adverse childhood experiences, or ACEs. And adversity in childhood is linked to mental health and physical health throughout life. So it's important as you think about working and creating a work environment that you also take into consideration what that young person's early life experiences might have been like, and that as you're setting up treatment and care and partnering with organizations to provide counseling and treatment and care, that you have people who are trauma informed, trauma sensitive, and that your organizations are trauma informed. So young people experiencing trauma, like witnessing a murder of a family member, sexual assault, are at elevated risk of psychiatric disorders, including depression, substance use, self-harm, suicidal thoughts. Some forms of physical and psychological abuse in early childhood might be associated with eating disorders. and mental health issues over the long term. And children and adolescents exposed to chronic trauma may have a greater risk for disorders and school failure. It might be difficult for them to stay focused and to follow certain kinds of routines. So it's important to keep those in mind, and that these groups that are living in poverty are at greater risk of exposure to trauma and less likely to have access to mental health services. So it's important as you think about bringing these individuals on board that you recognize the signs and symptoms of these ACEs, which might be depression, loneliness, anxiety. There might be somatic symptoms such as headaches and stomach aches, tiredness, poor eating habits, missing school or work, or disliking school and work, unexplained injuries, and maybe there might be some social avoidance that is evident in the way that they interact with individuals. So having a comprehensive strategy for addressing youth mental health so that you prepare them for the workplace, having a workplace and school and community culture that is engaging and non-stigmatizing is really, really important because this will allow the young people to feel safe, to feel that they have someone that they can talk to and share their concerns without being judged and without being stigmatized. So in thinking about, again, these organizations, if you don't have the counseling staff within your organizations, partnering with community mental health organizations and agencies are really important. They may have evidence-based programs that can help provide that positive climate and promote skills in dealing with conflicts. Kids that were bullying may not know how to deal with conflicts, or they may deal with them by acting out in the workplace. Early intervention strategies for supports such as groups that deal with grief and anger and sadness are important, and treatment programs that directly address those needs of students, especially as those mental health concerns go beyond what we call subclinical and may need a clinical diagnosis where much more support might be needed than what you can provide within the context of your organization. So with that, I'll stop. Youth spend the majority of their time in school and with adults. We need caring adults who can embrace these young people and who can help them find a path toward well-being and resilience. And in doing so, we will have a very strong and healthy workforce. So I thank you for your time and your attention.
Thank you, Dr. Maholmes. So the employers and sponsors who are listening, the takeaway message is to partner with an organization and also addressing the depression and the bullying effects and look for the warning signs and provide those webinars or provide those services to the young adults in your organization and provide those services. Remember that these young adults, they went through so many different things like the 9/11, the gun violence in their schools, and the pandemic, the opiate problems, and so many different things, including the housing bubble and the economic depression, and that we fortunately didn't have to go through in our life. So they had gone through so much mental, stress and the impact through the society and the environment, and we need to pay attention to all of those stressors and the risk factors. Now, it is with great pleasure and it is my privilege to invite my esteemed colleague and friend, John Sharp, who is our Senior Director for Apprenticeship and Career Development at net.America, and he has directed the projects and apprenticeship work at the Restaurant Association before he joined net.America, and he is the project director for the Youth Intermediary Contract, and he will be introducing our keynote speaker, John Gaal. John Sharp, it's your time now.
Thank you, Padma, for those kind words. I first met our keynote speaker, Dr. John Gaal, 20 years ago in Kansas City. We were partnering together to develop the Skills USA national competition in carpentry. The Home Builders Institute, with whom I worked at that time, partnered with the St. Louis, Kansas City Carpenters Union to develop the competition and also to evaluate each of the CTE students and community college students' work on the program, on the competition itself. We did that for many years, and later on I got to know John through apprenticeship when he served on the advisory committee on apprenticeship for the Office of Apprenticeship, and then more recently through the workforce boards. John currently is the director of the Missouri AFL-CIO Missouri Works Initiatives Worker Wellness Program. He's still a labor representative and serves on the St. Louis County Workforce Development Board and International Vocational Education and Training Association's Board of Directors, of which he is the president. He completed a union apprenticeship in carpentry 40 years ago. I completed my electrical apprenticeship 40 years ago. Of course, we always call the carpenters the wood butchers, but that's our own thing with electricians. He got an associate's degree and a bachelor's degree in architecture, a master's degree in international business, a doctorate in organizational leadership. In addition, he completed postdoctoral projects at Harvard University, the University of Florida, and he was honored to receive 2 Fulbright scholarships. He's published numerous articles in peer-reviewed and professional journals on issues related to various aspects of workforce development. And I can honestly say, I don't think there is anyone in the country who has more knowledge of apprenticeship than Dr. John. Since 2018, John completed the mental health first aid trainer courses, NAMI family-to-family teacher training course, Missouri Certified Peer Specialist Certification, NWI Certified Wellness Practitioner Certification, QPR Trainer Certification courses, CWM Suicide Trainer Certification courses, and Missouri Community Health Worker Credential course. John has been married for 38 years, has 4 children, and is in his 27th year as an adjunct professor at Webster University. John, it is my pleasure to introduce you, Dr. John Gaal.
Thank you very much, John. I can't tell you how great it is to spend this time this afternoon, for most of us, discussing something that's near and dear to me, and that's wellness in the workforce. I really appreciate the background support that I've received to be able to deliver this presentation and keynote today. So I want to shout out to Padma and Tyranny and Juan and John Short. Again, thanks a lot. So let's move to the next slide. Just to let you know, it's want to try to keep things on track here. John did a pretty good job on delivering the intro of who I am, where I came from. We're going to have some polling questions just to get the audience engaged. And then we'll move into the statistics and a pilot study that I performed. And of course, I would like to have a call to action because there's no sense in us discussing these most important issues today without giving us some marching orders. And that will also deliver some key takeaways and then have a few minutes for Q&A. Because this presentation touches on some very traumatic experiences for some of us, be it substance misuse or suicide, someone near and dear to us or ourselves, I always like to have a trigger warning and say that if you need to leave the presentation, then please do so, but know that there's help available. Thank goodness to Congress back in July. We now have a 3-digit number for our National Suicide and Crisis Prevention Lifeline, and that is 988. So if you need to step out of the room, know the help is at your fingertips. Next slide, please. So this is our first polling question. So back in, I guess it was the spring of 21, Mental Health America published a report, and they had surveyed thousands of employees across the United States from different industrial sectors. And they basically were trying to figure out how many employees felt that their workplace stress also impacted their mental health. So what do you think percentage-wise? Was it 25%, 45%, 65%, or 85%? And the polling question should come up for you. Tierney, I'm not sure if I'm supposed to be seeing something here other than the slide. And we'll give it a few more seconds. Okay, can we see the results, Tierney? So the correct answer is 85%. Now stop and think about that. That basically is telling us 9 out of 10 people who responded to this question from all those different industrial sectors, I believe there was over 3,000 participants in this study, 9 out of 10 of them across the board said that the stuff that goes on in the workplace is impacting their mental health. That kind of sets the tone for us going forward. Next slide, please. So in this slide, I want you to first focus on the graph on the right side. This is from the Wall Street Journal back in August of this year. And it is basically talking about the state of our nation with regards to serious mental illness in the past year among U.S. adults. And notice where my arrow is pointing, and that is pointing to that maroon line. And that has the largest jump. And if you cross-section that color to the legend above, you see that's the 18 to 25-year-olds. So that's across our population. So what I want you to also focus on is the note to the left. So I come out of the construction sector, so I'm a little bit biased today talking about apprenticeship, but the fact is, when it comes to male construction workers in that same age group, 18 to 25 years old, these individuals are 5 times as likely to report some kind of serious psychological distress and upwards of twice as much to report suicidal ideation than their counterparts who are 50 years or older. Next slide, please. So over the years, as John said, I've been in this game for quite some time, 40 years, but in the past 20 years, I've done a lot of research on my own and partnered with other institutions and other researchers. This is a survey by a group called the International Foundation of Employee Benefit Plans. They have about 40,000 members across the United States and Canada. I would say the vast majority of their members are in the construction industry, but that is not to say that's the only industry they represent. I know there are firefighters, there are teachers, there are nurses, there are actors, and so on and so forth in this organization as well. And they represent mainly the trustees of the pension, health and welfare, and training trust funds. So about 12 years ago, the IFEPP decided to put out a survey. And they surveyed the training coordinators across the United States and Canada. They had about 130 responses from those in the United States and about 35 responses from those in Canada. And these are the results. They were basically asking these training coordinators about their perceptions of their apprentices with regards to mental health and substance misuse issues. And we can see along the top row that over a third of the training coordinators in Canada had serious reservations with regards to their apprentices and sleep deprivation. We can see to the right of that, that it was really about a 50-50 split for the US and Canada with regards to alcohol and alcohol addiction issues. And then to the right of that, we can see when it comes to substance misuse and abuse and addiction, whether it's from prescription or non-prescription drugs, we see that, again, both the coordinators in the US and Canada are about 50% very concerned about their apprentices misusing drugs. But let's really focus down below, and let's start to the left. We see that the training coordinators in Canada, there's about a quarter of them that were concerned about their apprentices with regard to suicide and suicidal ideation. Notice with depression, over 50% of the Canadian coordinators were concerned with, where over the US coordinators, only a little over a third were concerned about issues of depression regarding their apprentices. And then to the far right at the bottom, this one really kind of sets the tone. We said over a third of the training coordinators in the United States were concerned about their apprentices with regards to anxiety disorders, whereas in Canada, over 2/3, almost double in Canada. So I just wonder if the Canadians had a little better handle on what's going on in their apprenticeship population than that in the US. But take the time and look from right to left across that bottom row and notice how the anxiety is so large. And then you move to that of the depression, and it moves slightly lower. And then you move to the suicide, and it again moves slightly lower again. The point I'm trying to make here is that anxiety often leads to depression, and depression sadly sometimes leads to suicide. So it's very important for us to take note that even though these were perceptions of these coordinators, it's something that we should take into consideration in planning our curriculum and delivery of instruction. Next slide, please. So the next question, this comes from the HHS, Health and Human Services, back in 2016. And that's very important here. In 2016, on average, how many people died from an opioid overdose each and every day in the United States? Do you think it was 16, 60, 116, or 601? And this is per day. So the polling question should come up for you. I'll give you a few more seconds. Well, if you selected C, 116, that was correct in context to 2016. And let me delve into that a little bit more. Next slide, please. So this supports what I just said. I want to make sure that you understand that there are some really key points on this little infographic that came to us from the federal government. And I think one of the big ones is you really have to understand that over 70% of the people who turned to heroin actually started out on a prescription opioid. Those numbers are rolled into these figures you see here. The very bottom of this infographic has a huge number, over $500 billion. That is the economic impact of these 116 people dying each and every day back in 2016 to our national economy. So it's not just about the person being sick and not coming to work and causing a disruption on a job site because the crew's not full. It's also about that person not going to and from work, obviously using gas, maybe stopping off at the gas station and picking up a soda, not just gasoline, and things of that nature. So it's a trickle down effect as well when we look at that $500 billion that it's costing our nation. And that's not to diminish, obviously, the 116 people who die each and every day. Next slide, please. So the reason I really wanted to point out this issue of 2016 is that these numbers are from this past August, but they reflect what went on essentially in 2021 with regards to drug overdose deaths in the United States. Notice how this chart moves upwards to the right. But let's look in that area first, in that 2015, 16, 17, 18 era. You can see that it actually dips down a little bit. And this is an indication that we were starting to get our arms around the opioid crisis in this nation. The bottom line is something was introduced in 18 and 19 that made that spike up again to what you see in 21. So we lost last year nearly 108,000 people in this nation to drug overdoses, of which over 74,000 of those were related to opioids. If you do the math, that's 9 people an hour, every hour in 2021. Again, why is this so important when it comes to apprentices? Well, more specifically, construction. Because if you look at the CDC data, you will find that when it comes to construction, that industrial sector is number one when it comes to opioid misuse. And it's number 2 when it comes to suicide. Next slide, please. So let's move into the topic of suicide. And you can see right here that in 2020, nearly 46,000 people died. And again, trying to draw it down to, days and hours and minutes, that is one death in this nation every 11 minutes. Now, keep in mind that when COVID hit, what we saw was researchers becoming very concerned that there was going to be an upward spike in substance misuse as well as suicides. And what the researchers told us late last year was, yes, there was an upward spike in substance misuse, but and not so much in the suicides. The suicides on average remained flat. So there wasn't this huge spike. Keep in mind, though, that that's an average number. And so when you disaggregate that data, you will find there are populations, groups within our population here in the United States that were negatively impacted. Black Americans had over a 5% increase in suicides during that time frame after COVID. So you got to watch when you see a general number, because you really need to make sure you're addressing your community and its constituents. So again, we have issues of substance misuse that have been exacerbated not only by COVID, but by the introduction of fentanyl. That's why you saw those spikes last year compared to 2015, 16, and 17. People in the trades have to work through pain. And one of the ways they work through pain is they use painkillers. And sadly, what the data is showing us is that you can become addicted to painkillers in 5 to 7 days. So people end up often in a downward spiral. And again, issues of anxiety, depression sometimes lead to suicide. Next slide, please. I often tip my hat to our service members because they allow their service allows us to have a free and open discussion like this today. And I think we need to acknowledge the fact that we haven't done a great job with regards to handling their mental health issues. Many of them who have experienced head trauma in either the Iraq or Afghan theaters are coming back with PTSD issues, often leading to issues of traumatic brain injuries and CTE. And we have to be very careful that we understand that, because we are losing. More recent numbers are showing us around 17 former and current service members each and every day to suicide. A couple of years ago, it was closer to 25. So yes, we're doing better, but we need to do much better, because if it's your friend or family member who's one of those 17 more recently, then that means a lot. Next slide, please. So the next polling question is, so according to the CDC data back in 2016, which occupation had the highest rate of suicides per 100,000 females? So do you think it's artists, retail, iron workers, laborers, or nurses? So the poll should be open for you. Give you a few more seconds. And when we flip to the next slide, we'll see the layout here. You will see that respect to that question, it is artists that we lose about 96 per 100,000. Now, consider the fact that when it comes to females in all occupations, it's closer to about 8. So if 8 is the average, and that's the benchmark, you can see all these other occupations above have a lot of work to do on either side of the table here, whether it's male or female. And notice for male, it's 27 per 100,000 for all occupations. So again, these are numbers that we have to acknowledge, and we have to, again, figure out ways to create an environment in our apprenticeship training programs And when I say apprenticeship training programs, I'm referring to the work on the job, as well as if it's at a employee organization such as a union, as well as at the training school. Next slide, please. So when I retired at the end of January 2019 from my 40 years in the construction industry, I had some time on my hands, and I gave a lot of thought to that study I showed you earlier from the International Foundation with all the circles, where they surveyed the coordinators from the United States and Canada. And I thought to myself, that really gave me a lot of good data, but I think there's a way to get better data on those same questions. And that is go straight to the horse's mouth. Instead of asking a coordinator what their perception of their student body was, why not go to the apprentices and give their own perceptions to these questions? So I just picked out a handful that I thought were significant. There was a survey I put together that went on to become a published peer review article. There were 27 questions, and I've got about 5 or 6 here that I want to share with you. I asked about in your apprenticeship program, have you been exposed to stress management trainings over the past year? Have you had experienced any stress or anxiety due to mistreatment in the job or the program? Have you experienced any stress or anxiety due to unsafe conditions in the program? Likewise, have you experienced any stress or anxiety due to your concern about where your next job's coming from? Remember, this was to construction apprentices, and it was a pilot study. And so they move from job to job. They don't typically work at one job, one location for the rest of their lives. And then finally, did you experience any stress or anxiety in the last year due to money issues, that you were going to be lack of money? Let's see what those findings were related to stress. Next slide, please. So we found that nearly 100% of the participants had not been exposed to stress management trainings in their program. Over a third of them sometimes are often stressed that they were often stressed by mistreatment within the apprenticeship program. Over 30% sometimes often have anxiety concerning unsafe job conditions. A third of them were sometimes often stressed over not knowing where their next job was coming from. And just slightly under 50% were rarely to never stressed due to lack of money to cover essentials. The last bullet point here really has a double meaning to it. So, in a world that really pushes for productivity, obviously doesn't reward us for taking too many sick days, I asked about the whole issue of sick days. Well, 90% of the participants indicated they rarely to never have taken a sick day in the past 3 months. Now, if you look at some of the more recent data, this has kind of been flipped on its head, especially in the IT sector. Many of the people that are up and comers, the 18 to 35-year-olds, are very concerned about their mental health and are really pushing for mental health days, and they're taking them. And I think that's going to flow out and trickle down into other industries. Next slide, please. So when it comes to stress and this mistreatment issue within the industry, over a third of the apprentices experience bullying. And that bullying came in many different shapes and sizes, whether it was intimidation, verbal abuse, harassment, name calling, or damage to their personal property. Basic and McCallum basically tell us that resilience matters. When people have hardy characters, they are in better shape to experience stress than those who are non-hardy. So those people who don't have a practice of work-life balance. They don't aspire to wellness and well-being issues with mind, body, and soul. They're probably going to have a tougher time dealing with this mistreatment than those people who do practice work-life balance. Next slide, please. So the last question I answered in that research back in 2019 was, if you had a stress or anxiety issue, where would you turn for help? And let's flip to the next slide so we can go right to. I think the three biggest concerns were, to me, was, first thing was around 20% of the participants did not even know where to go to find stress management assistance. That's very concerning. Someone's dropped the ball, either in HR or in management, not clearly explaining what's available to their employees with regards to receiving assistance. And then the concerning pieces here really are that 0% of the apprentices in Toronto or in St. Louis said that they would consider their local hospital or clinic for available resource. And equally concerning was that 0% of the apprentices in Toronto and St. Louis did not consider that their employee assistance program or their member assistance program as an available resource to get that help. Again, let's move to the next slide. And this is one of the big reasons why. There are actually 4 reasons why employees don't use their EAP programs. 1, they think they're not confidential. 2, they think if they're found out using them, that's a sign of weakness, and therefore there's a stigma attached to it. 3 just really kind of blows my mind. They think they need permission from their boss to use their insurance plan. EAPs are part of your insurance plan if you have one available. So keep that in mind, and thus are covered by HIPAA. So it should clear up the other 2 points above. And sadly, number 4 is they don't even know they exist. That to me is something else. So next slide, please. What's the call to action? Well, when it comes to substance use disorders and opioid use disorders, there are resources available. I worked on both these projects at the University of Missouri Extension with regards to trying to create a framework for a recovery-friendly workplace. And more recently, Washington University, I worked with them to create guidelines for the construction industry for management to know how to better assist their employees to get help. When it comes to suicide prevention, I really encourage everyone on the call today to reach out to CIASP. If you go to their website, about a third of the way down on their landing page, they'll have a piece called Living Works. Living Works has offered free a 90-minute tutorial, interactive tutorial on suicide prevention in the workplace. And it's not just for construction, it's for all walks of life in the workplace. Again, if you're looking to integrate mental health issues into your apprenticeship training, it might be wise to check out the QPR, the Question, Persuade, Refer training program. It's a 1-hour program for suicide prevention. And I think if you're familiar with your local chapter of your American Foundation for Suicide Prevention, you'll know September is Suicide Prevention Month, and they often have what they call Out of the Darkness walks in your local communities. The next piece is peer support. There are 2 really good models out there, especially in the construction industry. One is based out of Australia. It's called Mates in Construction. That's a suicide prevention model on the job site using peers. And another one is up in Massachusetts with the laborers union called Lean. and that's for substance use, more specifically opioid use disorder. Next slide, please. So what are the takeaways when it comes to substance use disorders and opioid use disorder? Educate on those issues in your training programs. When it comes to suicide prevention, be sure to provide active support through peers and your EAPs, and make sure your employees know how to access those EAPs. We need to break the cycle of hazing and harassment. You all are involved with apprenticeship, so you know what I'm talking about when I talk about 29 CFR 29, as well as 29 CFR 30. Have you reviewed 29 CFR 30.3 lately? You have a responsibility to ensure that anyone who has regular contact with an apprentice on an annual basis has to go through specific harassment training. And then finally, the peer support models. I can tell you that in my area, we're really looking forward to trying to pilot something when it comes to peer support in the construction industry. And we're turning to our local community colleges, because most every one of them has a community health worker program. And we see that it might be the best route to go, especially in light of the fact that the HCAP program, HRSA, and many others, including the Department of Labor, I have to hand it to them. More recently, Department of Labor has really pushed, especially in our area, to recognize this as an apprenticeable trade. And there's grant money out there to meet those needs. So we see that as a great opportunity to skill people up. And so with that, we'll go to the next slide, please. I want to thank you. I also want to point out that there's my personal contact information, as well as a note in the lower left-hand corner of our weekly blog. We do a weekly blog on worker wellness issues, so be sure to check that out. And of course, if there are questions or concerns or comments, we can take them going forward. Again, I thank you all, and I appreciate the opportunity to speak to you. Very honored, and was a pleasure. Back to you, Padma.
Thanks a lot, John. And thanks, John Schott, for inviting John Gaal. We learned a lot. I personally lost 5 young adults and young professionals just in the last 6 months to suicide. So it's a great learning experience. For want of time, please ask any questions to John Gaal through chat, and he'll be happy to answer your questions. And I'm going to invite Michelle Day, the Director for Equus Workforce Solutions Intermediary, and she will be moderating the next Youth Apprenticeship panel. And our panelists will be discussing in great length about the mental health issues and how do you monitor and how do you train our young adults, and also give tips for our youth employers. And Michelle, it's your platform now. Thank you.
All right, thank you, Padma. I'm Michelle Day, and I'm the National Director for Equus Workforce Solutions, and I'm excited to have our panelists introduce themselves. So thank you for joining today. And Dr. Swarbrick, can you introduce yourself, please?
Yes, hi, I'm Dr. Peggy Swarbrick, and I'm at the Center of Alcohol and Substance Use Studies at Rutgers University in the Graduate School of Applied and Professional Psychology.
Thank you. And Angel?
Hi, how are you, Michelle? My name is Angel Maria Cruz. I'm the founder and CEO of Liberating Women, LLC. Our organization helps women, children, and families in transition from domestic violence, incarceration, and life-challenging circumstances.
Thank you. And Kirk?
Hello, everyone. My name is Kirk Liu. I'm the Director of Youth Initiatives for ODEP, the Office of Disability Employment Policy within the Department of Labor.
All right. Well, thank you again for everyone for being here and and being part of the panel. I have a few questions I'd like to ask. Starting with, youth apprenticeship sponsors, employers, and mentors are responsible for providing a safe workplace for apprentices. In the midst of post-pandemic upheaval of society, what warning signs should employers and mentors be aware of when it comes to dealing with mental health and wellness?
Who are you starting with?
I'll go ahead and start with you, Kirk, since you jumped in. Thanks.
Well, so for us, so for us, we're looking at it from the federal government perspective. So the way that we provide support is we're supporting states, right, as they implement their career pathways and think about target populations. And when we think about youth, we want to be very holistic in our approach. We know that young people who have disabilities are also facing mental health issues. We know that those mental health and behavioral health issues were impacting them pre-pandemic. And then the pandemic exacerbated a lot of those issues. So we have to be very thoughtful in that application. So on a federal level, we're really thinking about how our partners are approaching it, whether we're thinking about young people with disabilities who are justice involved, young people with disabilities who are in foster care, who are dropping out of school, or who are involved in our workforce development system. We want to make sure that there is equitable access to programs and services, making sure the most underserved young people or those who have the hardest directions to career pathways are able to access these services. So whether it's us having discussions, understanding what we're talking to each other about, talking to our networks about, our systems about, having consistent messaging across the board is very important, especially since this is a priority of the administration. So I just wanted to kind of set the stage for me, since I'll be approaching it from that perspective.
All right, I appreciate that. Thank you. And Dr. Sparbrick, what warning signs would you say employers and mentors should look for?
Well, I think one of the big things is just people showing up and, being able to do the work. It's going to be like performance based a lot of times. If you know the person already and you start to notice a little bit of a shift in the performance of their own, their work, they're showing up, their follow through with things, the interactions with other colleagues or customers or whatever their service delivery is. It's, just those interactions. So there's like there's an occupational component to the work, the social, and those would be the main things that I would notice, or you would start to be able to pick up in a sense. People maybe not looking like themselves the same way they typically do, just sometimes it's subtle, and then sometimes it's overt, and many times it manifests itself in the person even just showing up, leaving early, or the performance that they're doing on the work that they're doing.
All right. Thank you. And Angel, anything to add?
Yes, just to piggyback off of what they've both shared, both Dr. Peggy Swarbrick and Mr. Kirk Lewis. Because we work very intimately with those who are already faced with trauma, it's important that we have a dynamic where we are working close-knit and that we have a relationship with one another. Part of that is us speaking openly about what's happening that may be impacting us, so that we may or may not impact our job performance, and how we are able to help the clients that we serve. And so, part of that dialogue and conversation, if you're noticing that maybe from the time that you've met this individual, there may be particular signs that may be physical appearances, they may be distractions, they may find a little edginess, a little shortness in communication, or if you find that their behavior patterns have shifted, then those would be great signs for us to delve a little deeper, have another conversation, and to be able to, really pan out and flesh out what the true root may be going on. It could be some level of stress or abuse or another level of crises that they just aren't yet quite comfortable talking about, but it is very visible to those who are sensitive to the industry.
Thank you, and that's actually a great lead-in to the next question. So, if you notice changes in either behavior or performance or appearance or distractions, things that you've mentioned, what resources or strategies can employers or mentors, what strategies can they use, or what resources are available for employers and mentors?
I think the first thing you should always think about is trying to keep it as natural as possible. Use the relationships of the supervisor or the colleagues, creating an environment where people feel safe to reach out to someone. And, perhaps it's just, they just needed someone to listen to them or talk to them or feel comfortable and safe in that environment. So the first level I always think about before you start throwing people to a service or something, because that could be triggering of itself. It's just creating a work environment where people can feel comfortable with colleagues and the supervisor. So that's a big piece of it. And then depending on what the person, needs or wants at that time, potentially there are, the things to link people to, but it's always don't want to start putting out the fires with huge fire hoses when it really just doesn't need it, and just overreacting to it, because sometimes that is, again, triggering for youth, particularly being too, because people will take oh my goodness, and, let's bring the police in here or something. And then it's like, oh my God, they just needed to vent, just like everyone needs to vent about something, So that's one of the things I just would be cautious as not to be too heavy-handed on, like throwing people to something, rather than creating that safe environment and a place where people feel okay to, vent them a little bit.
Yeah, I love that. I love and appreciate that reminder. It does start with the relationship and having that safe space. And it doesn't matter whether you're a youth or young adult, or if you're seasoned like I am. We do need a safe place to have a conversation. Angel, any additional thoughts, or Kurt?
Yeah, just to flesh that out, it's just an intimate circumstance. So some individuals are just not comfortable being verbal, and if you have a dynamic when your work team is closely knit and that you can have respectful boundaries, then there's always a way that you can kind of introduce the conversation without it being so very overt or so very harsh or so very in your face, when the individual may be having a hard time grasping with what's actually in processing with what's actually happening in their lives. So I believe that it is, as it is a sensitive matter, you just want to, casually walk through it or casually address it, or you want to make it as less intrusive as possible. And as Dr. Swarbrick mentioned, we don't want to make it a 5 o'clock alarm, right? When a simple, reach out and just touch the person, how's it going? Small talk around the water cooler can really help put things at bay, or at least give a better sense of how the individual is doing.
So I'll take that question from the ODEP perspective. So just to give you guys a little bit of an idea of ODEP, ODEP is a federal agency within Department of Labor. We work with all levels of government as well as employers to make a more inclusive work environment, improve employment outcomes for youth with disabilities, people with disabilities. Since I run the youth piece part of the work, we have a youth part, we have a system. So we're looking at workforce systems and how people transition into those systems. We're looking at how we assist employers with creating those inclusive workplace environments, and then assistive technology, looking at technology and different forms of technology and how that will make work more inclusive for people with disabilities. And we recognize that, to piggyback off of what everyone else has said, is that we need to help all of these entities understand what an inclusive mental health friendly workplace is. So whether it's resources like our mental health toolkit, which is provided by our EARN, which is our technical assistance for employers on assistance and resources network for employers, provides employers with resources to really create that inclusive environment, from everywhere from how you train your staff to how you orient people into work. And how do you create that environment? As we said, having these conversations really starts, with the agency creating a work culture and making it a part and embedded into the culture. We're also looking at how we engage policymakers. We understand policymakers have money. They influence legislation. So we want to make sure that there are policies out there that help them implement strategies from a state and local perspective that will provide, whether it's providing mental health services more seamlessly, figure out ways for partners to partner together better. We want to provide framework that will help states and locales figure out ways to do that. For myself, looking at youth and how youth need these services, as I mentioned, we recognize that a lot of the young people that we're working with are duly diagnosed. They're dealing with mental health issues as well as maybe developmental disabilities, physical disabilities, you name it. We got to think holistically about that. One of the things that is always a barrier is funding. We are trying to provide states with ideas and innovative strategies to use funding that's out there, that's available to them. So, for example, young people who are experience first episode psychosis, there is funding out there through CMS, through Medicaid waivers, and there's innovative ways that workforce systems, WIOA Title I programs are using those funds along with WIOA funds to provide programming for young people with disabilities and mental health issues. So being able to look at innovative ways to provide strategies, implement policy, create program designs that really meets the needs of young people and meet them where they're at is important to us. And we also just want to leave with this. We recognize that states and locales will only make change when they understand how that's going to impact them, how it will impact their performance, how it will impact the people that they're serving. So one of the ways we do that is we give them examples of how other states are doing it and a roadmap, a framework for how to actually implement. And we provide technical assistance through our technical assistance centers to help them do that as well. So we think about it holistically, really thinking about everything from how a young person may enter into a system to the employer's involvement to the policymaker, because we know they all play a role in this.
Thank you so much. And in addition, that sounds like there's some amazing resources available and technical assistance options available to help employers, whether who are operating apprenticeship programs or otherwise, to better serve our young adults, especially those with disabilities. Are there other topics or key topics or training topics that employers should consider including in their training for young adults as it relates to wellness? I know earlier that our guest speaker mentioned, making sure that you're touching on harassment, but in terms of wellness, what else should be considered?
I think it's important that we take a look at dating violence and how that can impact the workforce, right? I think it's important that we talk about the pressures of social media and cyberbullying among young adults. And there are a plethora of programs that are out there to help. I know that the was also helpful as a tool for sponsors of those who are in the apprenticeship is the National Council for Behavioral Health has a certification for Mental Health First Aid USA. And that is very helpful in being able to help monitor or identify what challenges may be going on, as well as the Center for Disease Control has, the Center for Disease Control and Prevention has free training so that as peers, mentors, counselors, we are able to better help navigate, guide, and even educate our apprentices on what to be careful with in the terms of their own relationships.
Yeah, it struck me, what you said. I think I'm speaking for myself, but some of us may deal with this on the, outside of work, with either our kids or our grandkids, but not necessarily in the work environment. So thank you for bringing up some of those topics that I think more of us deal with than we talk about.
Right.
I think another great resource that has been really shown, especially with youth, is developing peer support programs in the workplace. I've been involved in a lot of development of a variety of peer support models, for decades. And it's just the power of peer support. But within youth spaces, it's really important. And I've done a lot of work with youth on, using this wellness model that I'm very involved in, using like a whole person, physical, spiritual, social, intellectual, occupational, environmental, financial, viewing yourself holistically and using that model. And as I've adapted that model for different populations with the youth, I've learned, you really, the lessons you learn from youth. So the peer support, creating some informal or formalized peer support programs for youth is, I think, a real promise. And there are there's different models, and in workplaces, I think it's going to be essential to either, especially if it's high stress, high volume, burnout, that we're seeing in rates increasing. So I think that's just the peer support models are definitely a promising approach to, depending on the workforce, to think about.
So just on one thing that we're looking at from a youth perspective, we know that young people are entering into the system in a variety of different pathways, right? They can enter through a workforce program, through an adult literacy program, through an apprenticeship program. We owe a Title I, Job Corps, you name it. And what we know is that direct care staff are engaging young people. And if they aren't culturally responsive to the needs of their youth, and that could be a young person who is, of color, native, tribal, their needs are vastly different. The access to resources are different. The access to services are different. So not just having resources, but are your staff trained to culturally respond to the target populations they're working with? You have young people who are dealing with LGBTQ topics and issues, as well as mental health. Are our staff equipped to know how to deal with that, direct them to the right services? So what we're trying to do is really look at that training across the board and ensure that all these systems are thinking about that training holistically. We mentioned peer mentoring. We know we need to engage families. We can't leave families out. We got to think about their training and how we're developing their leadership skills. We got to think about the people that's around them. We got to think about their relationship to their communities. So being holistic in our approach and really thinking about how we train our staff and what they need to really respond to the target populations they're working with is really important. And I think we can't forget that.
Thank you. And the next question is for Dr. Sparbrick. Given that pandemic isolation has been identified as one of the chief issues today, that today's youth struggle to overcome, in many cases, this has led to a dramatic increase in the use of drugs and alcohol. While sponsors and employers are not social workers or psychologists, are there resources that sponsors and employers can recommend to troubled apprentices?
So I think if we went into out of it, the idea was that you wanted to know what resources are available if individuals are having challenges with substance use. So I think it's similar to the mental health.
Yes.
You're going to notice initially that, what's going on. It usually comes out. You don't always see someone with a bottle in their job, like that doesn't come. That's not really what it is. It's happening. It's the behavior. It's the interactions. It's similar to what we all described early on about how people might be interacting, acting, not performing, not up to themselves. So as you notice that as a supervisor or a colleague or a fellow worker or leader in an organization, it's just maybe, connecting to figure out what's going on with if the person feels comfortable and safe to share that this is a challenge for them. It's just perhaps linking them to what might be available with, for example, EAP type resources, or if the person has something. But again, it's just using as much initially the natural things you have available to you, and then being support, because, addiction is tough and it does not change overnight, and giving it a pill often makes it worse. So we have to be careful to not move right into the fix and just put a person in treatment and it's going to go all over. People go to treatment. I know I've been in this field many years. I'm very aged here. And it takes 20, 30, 40 inpatient where people, before they do it. And some people it's 2 or 3, and some people it's none. So the trajectory for people's recovery to cut down or quit a chemical is very different. So I think, again, we want to have the approach of the individual as we're engaging them to want to help themselves, to want to be well, to perhaps get them to a services, a similar kind of a way of one person at a time, and then perhaps finding out if they're receptive to maybe treatment, to some type of a treatment, and using that relationship that you have developed with them to have them start to talk with you about that, and perhaps linking them to either doing it on their own, which many people still do, and others who might need some other kind of more formalized treatments that are available. But the availability of things are there. It's there, and maybe there's access issues for certain groups, but it's just the need. We have to understand, why is the person doing this? It's numbing some pain. It's getting back to that first question about the mental health piece. So it really becomes really challenging, but I think it's a great opportunity to try to help someone, and work is healing for people. So that's the other end of it. Let's not just put the person on a disability after that. Let's try to keep them in work, or help them re-enter the workforce after they've perhaps gotten themselves together with this. Because work, I have to say this from 35 years, 40 years of my own recovery, it's healing.
Yeah. I was going to mention as well that part of a process that we work with is that we identify one thing when you come into the fold is that everyone has a responsibility, so that everyone feels like what their work counts and matters towards the bigger picture of the organization, and that their work matters and counts towards the progress of the organization as well as individual lives that we impact. And so although treatment is very necessary depending on where the individual may be with their substance misuse, it is important that we help the individual to feel like what their project goals may be, how they may be able to execute, and what supports do they need to help them execute. It's very important that the individual feels invested in, and that the individual feels like they are part of the team, and that is important, that they feel valued, that their input will make a difference, and that sometimes helps motivate to help navigate or talk through or address whatever issues that may not be really obvious in the forefront.
Thank you. And Angel, last question goes to you. Earlier you mentioned dating violence and social media pressures, and bullying, especially as it relates to social media. Any additional tips or thoughts that folks can take away on how to help with those circumstances?
Absolutely. One of the things is establishing healthy boundaries and healthy relationships. As it deals with, young people, the CDC would rank them from age 11 all the way up to 24. But this also applies to older adults as well. Understanding how to have healthy boundaries and healthy relationships are so key, because if they're not already implemented by familial structures, then it's important to learn what they look like, what they should feel like, and it's important for them to address that and begin to create boundaries and healthy relationships and dynamics with those that they're working with in their intimate partner relationships, their familial relationships, as well as their social relationships and their work environment. We would talk with them about, listening, careful listening, pointing out positivities, understanding, as I said, about healthy boundaries. That's also healthy communication, in ways that we can communicate truthfully, transparently, but in a way that's not accusatory, to not necessarily implement a combative or a confrontational disclosure, but how can we communicate in a way that is healthy, so that I hear what the individual is saying, but that the individual has an opportunity to take away what I'm saying, so that they could understand what my needs might possibly be in the dynamic. So we really look out for that and teach that. We want to talk about, physical violence. We want to talk about emotional, psychological violence, sexual violence, and understanding those boundaries as well. Understanding those individuals who identify with the LGBTQIA2S+ community, that they're not isolated by gender identities, but that they feel like they have a broad spectrum to communicate through and from, and that there is a reception at the end of their communication. And there's just so many other options and available strokes that I could share. I want to make sure that I do share that there are warning signs that we talked about a little earlier, whether physically, you can see physically if someone is completely looking like they're in a traumatic or crisis circumstance. And then there might be slight differences in their physical or social communication, or even electronically, when we talk about cyberbullying, that, if you're finding that quickly they can't necessarily put their phones down because they're in such a panic to try to respond, that might be an indication that there's something happening, and that might be some cyberbullying or texting that might be going on, that they feel so connected that they must immediately answer the phone, or they must immediately respond to a text while they're in the middle of the work dynamic. And then social media, is social media a work tool, or has social media become a tool of abuse and control, and that the individual is not quite feeling safe in that dynamic, or they're feeling this internet trolling, where someone's following you or liking everything, or now clocking where you should or should not be based upon your little icon on social media that says that either you're present or non-present. Is really an intrusion in privacy, but this is the world that we live in. And as a result of that, we are subject, and our young adults are subject to these various types of bullyings and abuses. And it's important that, again, once the individuals have clarity on what healthy relationships and communication is, that they have a forum to speak, and that they continue to build a strong network around them as well. And that network can be family. That network could be peers in school environment or in the work environment. That can be friends that are supportive, not enablers of the abuse. And then positive self-talk, understanding what one's boundaries are, and understanding that you do have a right to say no, or to excuse yourself, or a right to privacy, and you are not required to give an account of where you are 24/7. And it's not okay for people to show up in your workplace or your school or wherever you are uninvited, and understanding what that is, and helping the individual that when these triggers take place and these things are happening, helping them to understand healthy care, self-care, breathing exercises, reaching out to that support group so that they can get the help that they need, and then taking a deep breath and understanding that it's going to be okay. And then the mindfulness of understanding that if I'm not feeling safe, whether it be at work, in the workplace, whether it be in the social realm, or if even it's with intimate relationships, that there is help. There are some hotlines that I would like to share the phone numbers to, so that if individuals are feeling any of these things, and they have resources that they can always reach out to. Loveisrespect.org is an organization. That number is 1-866-331 9474.
And Angel, would it be possible for you to share the contact information in the comment section?
Absolutely.
And then Kirk, if you have it handy, could you share the link to the technical assistance as well?
Mm-hmm. Absolutely.
And then Dr.
ahead and share
Starbird,
that in the
same, if you have any resources you'd like to share in the comments. And I think we'll go ahead and do Q&A in the comments as well. So thank you guys so much again. And I'd love to continue the conversation, but we're going to pass it on to our next panelist. So I'll pass it back over to Padma.
Thanks, Michelle. That was a very exciting and interesting conversation. And thanks for moderating the panel. And our panelists were really, experts in their field, and they had wealth of information. And unfortunately, we didn't have enough time for the question and answers. But please put your questions in the chat, and they will be happy to answer any of your questions. Now we are moving on to the next panel with our expansion of registered apprenticeship program panel. And I'm happy to welcome our new set of panelists, Dr. Dennis Rodriguez, who is the director for New Jersey Coalition Against Sexual Violence program, Andy Hulse, as well as Andy Fisherman. And I'm going to be introducing them really shortly. Andy Hulse has worked in community service organizations for about 15 years, and he has worked on mental health and now in workforce services. He spent nearly 4 years as a one-stop operator at Equus, and Dr. Hulse has a doctorate degree in clinical psychology and was a practicing psychologist prior to joining Equus. And since he is a psychologist, he pulls up a lot of information from his mental health background and frequently leads trainings related in mental health topics. And it is really an opportunity, and we are fortunate to have him on our panel. Welcome, Dr. Hulse. Andrew Friedman is the Trust Director at United We Heal Training Trust, and he has served as the principal staff person of United We Heal Trust. And since its inception, including oversight of day-to-day operations, compliance, reporting, recruitment of apprentices, and recruitment and engagement with training agents. He serves as an appointee to the Oregon Workforce and Talent Development Board. He previously served as a trustee of the State Worker Training Trust and as a union representative at SEIU 32BJ in New York. He nearly has a decade work experience, and he will be an asset to discuss on the apprenticeship program. Dr. Rodriguez has a PhD in English, and after she left her teaching program, she started writing grants, and then she joined the violence prevention program, and she has been the director and interim director for the New Jersey Coalition Against Sexual Assault program, one of the state's leading voices in the anti-sexual violence movement and the capacity building specialist program. And that is where I think I met her, because I used to run the similar program at Middlesex Rape Crisis Center. And we are going to discuss several of these violence prevention at work environment today. And I'm going to be the moderator for this very important panel. And I'm going to be asking some questions, and feel free to discuss salient features and how we can prevent violence at the work environment for our apprentices, and how our mentors can look for signs of violence and address them at work environment. When I first came to this country, when you look at someone at the elevator and tell a woman or a man, you look handsome or gorgeous, it was not considered as harassment. But today you need to be politically right, and you need to be very careful in what you say or what you do, because sometimes this can be like, crossing the lines, and it can come under sexual harassment. Sometimes this can be over the line. Sometimes you have to be extremely careful, right? And we came from a pandemic when we worked at home, and we are now coming back to work. And there are people who took the vaccines, there are people who didn't take the vaccine, and there is all kinds of anxiety that leads to stressors and mental health issues. So my questions to all of you is that, as an employer and apprenticeship sponsors, and as mentors, they are responsible for providing a safe workplace for apprentices and employees. In the midst of the post-pandemic upheaval society, what warning signs should employers and mentors be aware of when it comes to dealing with the mental health and wellness of the workers? So you can take chances and you can respond to these questions.
Well,
who wants to go first?
I can go ahead and jump in. Thank you first for having me, and my apologies for my voice. I'm dealing with a bit of a head cold, but hopefully I am clear enough. But that's a really good question. And when we talk about, what are kind of the warning signs when we're working with folks in apprenticeships or working with employees, I think the first thing we look for is just change. If we're working with individuals on a pretty frequent basis, we typically kind of learn about their patterns and learn about their personality. So I think one of the first things we look for is if there is a change in kind of that baseline. That change can look like a lot of things, from disengagement. Maybe they are seemingly finding less pleasure in their work, or talking less about finding pleasure outside of work. So again, really the first thing we look for is just really that change. When we also look at well-being and mental health, it may come to a surprise for some people, but in very serious situations, we might actually see an inflation in mood. So where somebody, might kind of be a baseline of a 50, just putting it on a diagram here, but all of a sudden they come to work for 1 day or 2 days, and their mood is very, very elevated for whatever reason. So again, that's kind of a change from their baseline personality, if you will. But answering it kind of in a general way, it's that kind of change in their day-to-day personality and from maybe what we've gotten used to through our apprentices or our employees. So that's what I would recommend really looking at.
One point I wanted to add to that is thinking about who is checking in on apprentices. You can't assume that everyone is doing okay, but I think thinking about multiple people, that some people respond differently to different folks checking in on them. And so thinking about, particularly, some folks are going to be more responsive to their journey person, and some folks are going to be less responsive to that person and be trying to hide folks, and thinking about the cultural relevance of the relationships that they might have and where they might be more or less guarded in terms of what they disclose to whom. I also think thinking about the overall culture of what people are being journeyed into, and really trying to assess that in general, and not only thinking about the individuals in that environment.
Yeah, I actually, piggybacking off of that, wanted to sort of take this question a step back, because I think very often when we talk about workplaces and employees, or in this case apprentices that are in distress, we are starting with the perspective of what those warning signs are. And I think it's really important to create a culture where you have open dialogue, and so you're not getting to the point, which obviously may be inevitable in certain cases, but we can, I think, all work towards reducing the number of employees that come to us in a state of distress by implementing some really good prevention techniques, creating open dialogue, creating safe meeting spaces, having regular check-ins, having processes where folks feel engaged and a part of the work, and can take direction and leadership and ownership of their work. So there are a lot of things that I think we can do that go before we get to the point where folks are exhibiting signs of being overwhelmed, or feeling a sense of distress, or not belonging, that would help sort of mitigate that.
Now, thank you, Denise. Now you talked about belonging, right? So that again poses into the recent discussions on diversity, inclusion, and belonging, right? Now we talk about a lot on DEIA, and again, oftentimes, like employers are forced to have a certain number of people that you need to have X number of people from different minorities, ethnicities, and cultural groups, that you need to have them, make sure that everyone feels belonging. And if it is not, then there is going to be a repercussion, and there is going to be a policy enforcement. And because of that policy enforcement, indirectly, there is also, without a proper education, without a proper culturation, there is also a pressure, right? That pressure can also indirectly causes a mental health issue, correct? Like there needed to be a proper education, there needed to be a proper understanding on everyone, right, at every level of an organization, in order to have a proper belonging from top to bottom, from the leadership, from the board of directors, all the way to an entry-level job. So how do you think an organization embrace that kind of a belonging from entry-level worker all the way to the board of directors? And how can that situation, how can that education awareness can happen? Do you think you can have more webinars? Do you think that can happen as an organizational change? And how do you think such a education and awareness can happen?
It takes commitment. It's an ongoing thing, and webinars are fine and trainings are fine, but at the end of the day, this is the work. We prefer at NJ Casa, we use the word anti-racism work versus DEI, and we work with trainers, but we do more than just that. It's embedded into the culture of our organization, and it is something that infuses our meetings, our programs, our hiring process. So I think we need to move beyond just looking at this as sort of like this practical application that we can have like a training, and that somehow we're going to be able to shift the culture, when really it is a commitment on the part of every employee. As you said, it takes board members and folks in leadership positions and folks at every point of the organization to embrace that commitment, to revisit it in your work on a daily basis. It needs to be a part of the culture. And once it starts becoming a part of the culture, I believe, because I've seen it become a part of our culture, it is something that will be embraced. And it doesn't feel like something that's a responsibility. It's something that you want to do.
Thank you. Anybody else want to join?
I would just echo those comments that it isn't just a 1 or 2 time training. It is something that needs to be implemented into policies and into procedures and practiced daily. It can't be, we're going to talk about diversity because some event happened, which I think is really, that's really, I feel what we've kind of done a lot of, is an event happens, so we hold a training. An event happens, we hold a training. But it needs to be a more proactive approach versus a reactive approach, where it really is ingrained into that daily culture. And we talk about it as much as we talk about, performance metrics or outcomes of the business, and really put it into the culture. So I very much agree with what Dr. Rodriguez shared.
Thank you. And my next question is about the recent happenings. I don't know if you are all following the news with the NFL players and the social media discussions and the concerns, right? Oftentimes, even in the workplace, if somebody is tweeting or sharing some information, and if it is not in alignment with the workforce policy, I've heard that appointment orders were all rescinded, and there is a pressure on the social media, what you share, what you don't share, and you have multiple profiles on the work, social media. And what do you think cyberbullying as well as the social media pressures on the entry level workforce as well as on the apprentices? And what do you think, as an organization, as an employer, somebody can educate them?
I could take an initial stab at that. I do think that particularly apprentices and new workers are more vulnerable than the rest of the workforce. They're newer, they're probationary, they are learning their trade from colleagues in the workplace, and so I think they are in all of those ways kind of in a more tentative space, and so there needs to be kind of a hyper vigilant perspective in terms of being able to make sure that the space that they are being brought into is a space that is welcoming and supportive.
Thank you. And the another question is like with the individuals with marginalized identities, they are often at higher risk for violence and tend to face more or greater obstacles to accessing care and services. How do we better address the needs of marginalized communities and the access to the opportunities? And as a follow up, how do we attract and maintain a diverse workforce reflective of these communities to ensure that we are providing services through the lens of cultural humility?
I mean, I'm happy to take a stab at that question from the perspective of the work that we do around gender-based violence. There is a higher level of risk for individuals from marginalized communities, both to experience to be the victims of sexual violence, and also to experience obstacles in access and care. So when we think of how to best mitigate those circumstances, it's really important to go back to what we were talking about earlier, which is to make workplaces, create workplaces that center anti-racism principles, that work collaboratively, consistently on creating safe, affirming, and inclusive work environments. Because when folks come to these spaces for services, then they are met with the support that they need. And when they're not coming, we are able to address why it is that they're not coming. Are they transportation barriers? Are they language barriers? And if they are those kinds of barriers, then we can work to really identify and address those barriers. Because simply just hiring somebody who is Spanish speaking, for instance, and you think, okay, great, now I have a Spanish speaking person on my staff. This person will be able to provide translation services when I have a survivor who doesn't speak English and comes for services. But if you are not creating an environment where that employee feels affirmed and appreciated and valued more than just for their ability to provide translation, but as a person, then the chances are that person isn't going to stay. And so you're back to square one. So I really see that all of this is embedded in that correct question earlier about like, what are the practices that we're implementing to create environments where people thrive themselves so that they can then be a better support to others? Because overwhelmingly what we hear is in the helping fields and in fields where there's a lot of vicarious trauma is burnout. I hear it over and over again. And we have come to a place, I think, as a society where we just accept certain things. We accept very often that people burn out and therefore they leave. Well, instead of just accepting that, what are we doing about changing the culture so that we can keep talented, passionate people in the field in a way that feels sustaining to them? And that's my dog. I apologize, crying in the background.
Yeah, thank you. And also, this is going to be a big issue, especially when you have apprentices, right? With all of this access, and they, especially if you have somebody who is bilingual and they are coming as an apprentice at entry level job. I'm talking about certified home health aide or certified nursing assistant. They have linguistic barriers. They have barriers of transportation, and they don't know their job descriptions really well. So they have so many stressors, and they don't want to communicate if they are asked to work outside of their job duties in their client's place for the fear of losing their job. And this adds to a lot of mental health issues. And on top of it, if they have intimate partner violence or domestic violence, and their performance may not be really up to the mark, and how do an employer look for signs, and how do they even address those signs, and how do they address it so that their performance can get better? Because for them, these jobs are really very important. And in order to hold that job, they need to have a better performance, and their performance cannot get better if their environment gets better. So it's very difficult to look at these stressors and then answer those stressors. That's why mental health becomes really very important. And oftentimes we offer this training program in a language that they don't understand. And that's what I'm trying to find out from Andy Holtz, as well as from Andy Friedman, who are in the workforce development, if they have any strategies to address these kind of barriers.
Well, that's a really good question. I think my initial response to that question, though, is, as an employer, we need to be thinking about how do we provide tools and resources to the individuals that we are employing or that are our apprentices. I think it's kind of the old school viewpoint of the employer, the apprentice has to adjust to what I want as a business. And I think moving forward, we, from kind of the business mindset, we need to look at how can we adjust to provide resources, support, accommodate to individuals who truly do have the skills, the qualities to provide the services that we want them to provide in a great way. So I think really it's, the mindset of organizations that it's not, if you don't do it my way, you're gone. How can we help you? I think that really needs to be the mindset. I don't want to go off on a tangent, but we talk about individuals whose maybe English isn't their primary language, or they have transportation barriers. What kind of support can we give them? For many reasons, but that's going to make them more successful as an employee. It's going to make them more willing or likely to want to work for that organization. So I think that's just important. But and then beyond just kind of the internal resources the business has, coming from kind of my workforce development background, how do we get involved in our communities just outside our own business to understand those resources? One, for us to offer staff, employees, or apprentices, but also so we can maybe do some education to ourselves or to our businesses. I think when we start getting, I don't know if it's out of our comfort zone, but if we kind of immerse ourselves with various organizations who work with diverse populations, we're going to learn better. We're going to feel more comfortable around different populations. And as a result of that, we're just going to be more comfortable in our interactions, and everyone's really just going to be more successful.
Just to follow up on that, I think it connects somewhat to what Dr. Rodriguez was saying a couple minutes ago. If you have a space that you're bringing apprentices into, that is not culturally relevant to those particular apprentices, and you've done some recruiting with a community organization to get those apprentices in the door, and you don't want to leave them. You don't want to. You want to continue to support them even once they are there with you. Think about those community organizations from whence those apprentices came, and engage them more long-term, more holistically, more proactively, in not just bringing apprentices to the doorstep, but engaging them in that organization throughout the training and mentorship and support period, so that you have organically a space that winds up being more supportive across more modalities of cultural relevance of those apprentices.
Thank you. That leads to the very important and the last question. Especially like in mental health and during pandemic in healthcare, many people were really stressed out, the healthcare professional and mental health professional, and that leads to very high levels of burnout. How can we address this and how do we support the employees? We can go from Denise.
Yes, this is something that we've been talking about a lot, the whole issue of burnout. And I think one of the things that we traditionally fall back on is this concept of self-care. Everybody talks about it. What does it really mean, right? And really, if you think about it, self-care doesn't work unless you have community care. Unless you have a workplace that supports you, the individual, the employee, to process what has been a very challenging time. For all of the distress of COVID, people working from home in certain instances really worked out for them. And having to come back into a communal workspace can be a challenge, or lingering concerns about health can be a challenge. Who's vaccinated, who's not vaccinated. There are a host of additional stressors that we are all confronted with. And folks that provide direct service and are in the helping fields and in the health fields have a heightened sense of the stress because they were on the front lines, right? They were providing services. And in the field of sexual survivor support, a lot of that is still happening now, because what we found is during the height of COVID, people may have experienced assault, but were not disclosing. And so those disclosures, as stress over COVID itself wanes, are coming out. So this has been a very stressful period for people in our field, and community care is essential. And what I mean by that is, when you think, for instance, of, somebody needs a vacation, and you say you need self-care, you go on that vacation, and you come back to a work environment where, people didn't sort of support you while you were out by hoping to kind of pick up some of the slack and some of the pieces, and didn't welcome you when you came back and made you feel comfortable. You're going from that place of serenity right back to that place of stress. And this is why it is so important that we not just focus on the employee, not just recommend self-care strategies, yoga and exercise, and all of those things are great. But if people are coming into a workplace that is toxic and that isn't supportive and that doesn't have resources, then very little is going to come of any practice of self-care. And in fact, you're placing the onus on the employee, which really isn't fair. If this is, if you're in a leadership role, it's your responsibility to try as much as possible to create a culture that is sustaining for your staff.
Thank you. Andy, then any one of the Andy Holtz or Andy Phil.
All right, I'll hop in here. I'm I'll take a little bit of a different angle on this, but I think there's a few things. First, I will say, again, I go back to, company policies and daily practices. Are we allowing and giving permission to our staff to, kind of hold up their hands and say, I've had enough, for a day or two. I think, we talk about burnout, when we talk about compassion fatigue, I think a lot of times, not all the time, but it's those folks who will go and go and go and give and give and give. And eventually we need to kind of get through to them that it's okay to take a day or two. So I think that's just, needs to be embedded into policy, but also into the day-to-day culture. And that's not just for caregivers, that's for all staff, because we're all human and we all at some point get to that kind of point where I need a timeout. So I think we need to make that a kind of a common practice, and it's not weakness. It's saying I need a timeout so I can come back better than I was today. I think the other thing we need to talk about too is, as Denise said, we say, go to yoga, take a walk, go for a jog. And I hear self-care a lot of times kind of coming up almost, in fads where, again, the pandemic hit. Now we're talking about it more than I feel we have in a long, long time. I'll be interested to see if it kind of goes away and then something happens again. But we talk about self-care. It really needs to become a habit for people. It's not just when they get to that kind of tipping point. It's great to use coping strategies when we get to that tipping point, but we really need to be using them every day. If a cup of coffee is your morning habit, how can we also implement that kind of coping technique on a daily basis to become a habit? So kind of our level of resilience rises and we may be less likely to kind of get to that tipping point.
Thank you.
I wanted to just add to this whole discussion of burnout, and I think getting back to some of the points that Dr. Rodriguez was mentioning. There's a field of research essentially at this point, which is looking at whether burnout is really the right term, and particularly in the caring economy, healthcare, education, whether it is more appropriate to qualify it as moral injury instead of burnout. That, I think, again, towards what Dr. Rodriguez was talking about, it's not that this individual is struggling on their own. It's that there's a real need to look at what the systemic situation is within this organization that's causing this situation, that's causing this disconnect. And when the disconnect gets so severe that people are reacting in a way that appears to be what someone would identify as burnout, it's particularly acute. But what are to take a step back and think about what are the organizational structures and systems that are in a place that are in place that are contributing to that, to those individuals reacting so acutely in that context.
Thank you. That's actually great points. Any other points that you want to add as a closing remark? I was just a couple of years ago when I used to work as a talent development director at Rutgers University. One morning, one morning, one of my colleagues walked into my office and he said, "Did you hear the news in the radio?" I said, "What happened?" And he said, "Our colleague was stabbed." I said, "Are you serious? She is just supposed to come to a meeting in half an hour." He said, "No, she and her daughter are just stabbed and they both are dead." And that was an intimate partner violence. And none of us knew any signs of it. And we had been meeting her, we had been working with her, and she was just such a close colleague, very, happy and working very closely with all of us. And nobody noticed any signs. And we had a university behavioral center where anyone could go confidentially and seek help. And Rutgers University Behavioral Center is such an amazing behavioral center. The reason I'm just saying is that no matter what resources you have, unless an employee feels confidential and confident to go and seek that confidential help, it doesn't happen. And we are now talking about apprentices and the entry level employees with all these barriers to go and seek those help in mental health, right? And that's why it is very important for us to keep pushing that information and educating them. To that end, I think this panel has done a very great and wonderful job in distributing this information. And thank you for everything that you do, Dr. Rodriguez and Dr. Hals and Friedman, for everything that you do and pulling that mental health information in the training and constantly doing what you do. And thanks for such a great panel and sharing all of that information. Thank you all.
Thank you.
And it is with a great pleasure that we shared all this information as a part of our National Apprenticeship Week with you. And thanks to Bernie, our regional director, for putting together this this event with us and joining all that planning session with us and helping recruiting the key speakers with us. And we are very thankful for this. And thanks to all the other intermediaries, Michelle, Desiree, as well as Rebecca. And thanks, John Short, for bringing the great keynote speaker. And thanks to Yasmin, Juan, and also Cherini for putting together all this and coordinating all the backstage information, and also to all our speakers. Now, help everyone that who needs mental health and behavioral health. Look for the warning signs. And if you can save one life and you can save somebody who needs help or direct them to the proper resource, you have done a great job. It's very difficult to create a life, even in the tissue culture lab. So please do the needful. Thank you and have a wonderful evening.